A very good evening to all the viewers. Welcome to the IJCP chat show on possibility and preventive measures for COVID fourth wave. The COVID 19 pandemic has led to a huge loss of human life worldwide and presents an unprecedented challenge to the public health, food systems, and the world of work. The outbreak of COVID 19 affected the lives of all sections of society as people were asked to self quarantine in their homes to prevent the spread of virus. Repurposing of safer, established medications that may have antiviral activity was the approach for treatment of early stage of the disease. So, to talk about the possibility of the fourth wave of COVID and what are the preventive measures to follow, I welcome Dr. Sanjay Jain, consulting physician at multi specialty hospitals in Nagpur. He has a rich 30-year clinical experience. Thank you, sir, for joining us today. Sir, starting with the first question here, what can be the clinical presentation if there is a fourth wave of COVID?
Madam, as we have seen the first and part of the second and also the third wave, the presentation more or less remains the same, though there are some more aggression in the second wave. Lot of people have directly came in the stage of ARDS, and there was lot of mortality as you already know. But I think in the this last wave, Omicron, the presentation were just either a low grade fever, body pain, and a lot of people I have seen with the diarrhea and the vomiting. So that was quite new, abdominal pain. So I think there may be mixed presentation also of the fourth wave. They may come with the coryza. Of course, I've not seen loss of taste or smell in the third wave, which was very prevalent in the first wave. But second wave was more of a respiratory distress, and finally, I think it's going to be mixed picture. Myalgia, all the viral presentation, viral fever-like presentation, arthralgia, then the coryza. There may be GIT symptoms like loose motions, vomiting, and in fact, I'm not expecting, or rather, I've seen the second wave so closely. I'm not expecting the seriousness this time. Uh, we have already seen it's now in the North Korea and some parts of the Europe and the America. We do from those we what we get to learn is the high grade fever is one of the symptoms, and then subsequently, of course, it's going to be like a viral fever. So all the viral components are going to be there. If the
So,
fourth wave, Nagpur, it's, I mean, right now there are nil cases, but one or two cases do come, and they got a similar presentation.
okay, so this is, so the if there is a fourth wave to come, it will follow the clinical presentations that has been so far, with fever being one of the primary symptoms of concern here. So, sir, also can you highlight on how different can the new variant be as compared to all the previous COVID variants?
Madam, what I can tell you from my personal experience, the first wave had taken a toll of lot of elderly people, but it was not very high mortality. But second wave surprisingly has taken a toll of lot of younger generation, 30 to 60 or 25 to 60. And in fact, the predominant symptoms were there was a respiratory origin, lot of interstitial lung disease progression, then finally the ARDS like picture, and finally the outcome was bad. So and then came the Omicron, which was it doesn't have not gone beyond the larynx to the lungs. So it was basically upper respiratory or the GIT symptoms in the Omicron. So I will be, I think if there is a conglomeration of the Omicron and Delta, that is Delta Micron, the symptoms may be combination of both URTI as well as the LRTI. And of course, I still hope that there should be not be much of the respiratory distress in the fourth wave, as we have gathered from the other parts of the country. Most of the patients are manageable at home. Hardly one or two deaths have been reported, uh, but of course, figure may be slightly lower. But that's what I feel. It's going to be mixed picture, but everything is unpredictable. Right now, Nagpur, we have not seen any patient going on the ventilator in the fourth wave, or just a manageable conservatively without many much of the drugs. Though in the third wave, we have used a lot of antibody cocktail, and subsequently we have realized That's it's not of any use, such a use the costly drugs. We have used lot of molnupiravir, and somehow I feel their patients have responded well. And of course, the supportive line of the doxycycline, and not this time we have not used much of the hydroxychloroquine.
So, sir, this is actually a great news that currently there are no cases in Nagpur, and even if they are treated at home. And so here, sir, you also mentioned about first wave affecting the elderly and second wave affecting the middle age. So, sir, the current wave, if it is to happen, then how about what about the vulnerable age groups? Is it possible that they can contract the virus again? Are they at risk of contracting the virus again?
If they are not vaccinated, I think the risk is high, and particularly we have started vaccinating the children late, so the chances they may be getting affected this time, because we have seen the trend. The first wave elderly, then the second wave with younger people, third wave it was a mixed picture, but we got a lot of middle-aged and elderly people, but that was very very insignificant symptoms. They are very well managed at home. But children's, though I'm not a pediatrician, but I've seen, I've learned from our pediatric colleagues, they are getting affected, but they are doing otherwise well with a very symptomatic treatment. The only issue is that now we started vaccinating, so they maybe get that preventive field from, or the preventive, the prevention from the vaccination, and they may get. So there is no rise in the symptoms, or most of the time they are maybe asymptomatic, but there is no mortality I've reported as far as the children are concerned. They may be prone, and they may be having a similar symptoms of coryza, fever like things, but none has gone out of control as far as the children are concerned. And even the elderly are doing well because most of the population are vaccinated, and perhaps that is the reason.
So, so yes, so the children who are not vaccinated, or the people who are not vaccinated, are or can be at risk, but most of them are showing asymptomatic symptoms, so that can be well controlled. So, sir, since they are asymptomatic, milder cases, what are the treatment options available for them for the mild cases?
Mild cases to be managed symptomatically, as we have managed in the first wave also, and even in the third wave with the Omicron. Just manage the symptoms by antibiotics, or the uh, sometimes anti-inflammatory for the more pain. A little bit of, if the child is more than 8 years, we have given doxycycline, but that is a plus minus, and little bit of antihistaminics and other drugs, and they can be given the overall zinc and other things, but that has lot been controversy in the second wave, whether that has caused the increase in the mucormycosis and all sorts of things. But managing just conservatively, observing the oxygen level, and doing the CT if it is required, if the oxygen level is going down. I think most of the patients have managed very well symptomatically without any issues in the this latest wave, Omicron. And children's particularly are least affected, and I think maybe because of the immunity status. And of course, now as I've said, now we have started vaccinating, so we have less and less to worry.
Yes, correct, sir. So, sir, also you mentioned about people requiring oxygen, or getting hospitalized. Very very few cases, but there is a possibility. So, sir, what are the treatment options available for the moderate or a severe case of COVID? Even if they are very limited, but what can be the treatment option for them?
See, if you do the genome testing and we find that it's a delta, then I think better option is the antibody cocktail, which is costly, but still within the reach of a common man. And secondly, that time we have used the antiviral drugs, molnupiravir. We give oxygen support. Steroids, of course, has to be used with very, very great caution if it is really indicated. But there is no role at that time. Also, that was very controversial to use the drugs like tocilizumab and other drugs, which has suppressed the immunity along with the steroids and has caused the severe rise in the fungal infection. So my message is, If there is a
Hmm.
need of oxygen, give oxygen. If there is a need of BiPAP, put up them on the BiPAP ventilators. And of course, anticoagulant was the issue right from the beginning. So you can give either heparin or the oral anticoagulant to start with. And lot of other drugs which are the biological modifier or immunosuppression has to be used with great caution. And we can have a antibiotic which has got a dual effect on the bacteria, viral like doxycycline can be used, and we have used extensively. So antiviral drugs like antibody cocktail or molnupiravir, and of course earlier we have used lot of favipiravir, but there is always a controversy. Nobody knows what is exact. But we have used, people have responded, some people have not responded. So this is the line of treatment. It is going to be mostly symptomatic. We have to concentrate on oxygen. We can use the antifibrotic drugs like nintedanib and the other one, but they are all under the controversy. So my message is very clear: treat them symptomatically, if at all needed. But most of the time, you see that their oxygen level should be in a good range without any discomfort, and that's how we are going to manage along with the anticoagulants. So these two basic drugs have been approved throughout. Steroid is controversial, antivirals are controversial, and this immunosuppressants are still controversial, and they may have played the havoc during the second wave.
So, very clear, and the message given by Sir here is that in the coming wave, or if there is a possibility of the coming wave, symptomatic treatment is what is required to be done, and also maintaining the oxygen levels is important. So, the two criterias that Sir has mentioned here. So, Sir, also, if there is the new variant, can it lead to serious complications? If oxygen level is not maintained, or can it lead to
Yes,
any
yes.
severe complications?
See, the main complications what we have seen in the COVID is the, the interstitial lung involvement and the hypoxemia, and subsequently patient needs ventilator, prolonged ventilations, and ventilator related complications. Subsequently, it is affecting all of the other organs of the body. But we have seen also the intracerebral hemorrhage and other things during that time, or intracerebral thrombosis. Cerebral hemorrhage is because of the heparin which we have used extensively, but we do get the patient of thrombosis. But this time, the main concern is only the respiratory tract. If at all the complications we are expecting in the respiratory tract. But what I have seen during that time, the patient was very well maintained on the ventilator, oxygenation is well maintained, suddenly there is a bradycardia. So there was a uh, thought there was an element of myocarditis which is killing these young people suddenly. So we have to be careful from all point of view. And there is a upsurge in the blood sugar. There is a hyperglycemia because of the pancreatic injury of the due to the virus affecting the head of the pancreas, pancreatitis and other things. So rise in the sugar, control of the diabetes is important, and then subsequently all other infection. But we have to be wary with the immunosuppressants, steroids. So main issue we have to see is in the lungs only, and that is a whole. If you support the lung throughout, we have seen the patients who were ventilator, BiPAP ventilators particularly, on a very long time, 40 days, and then they came out, and subsequently over a 6 months time, the lungs are also become cleared, they became off the oxygen, but it was taking long time. So you need to have a patience, you need to have finances, you need to have a lot of logistics.
So, if there is complications, then it will be more of respiratory related complications, and supporting the lung is important here. So, sir, you mentioned about that it takes a lot of time for recovery to take place, and everybody needs to be patient about it. So, sir, what is long COVID, and can it affect children?
So this is what I'm talking is a long COVID, the complication which extends over a years or months. And what I've seen is our experience is up to 2 years. And what we have learned in the experiences from the second wave of the COVID, the patient taking treatment up to 6 months, and this is what is long COVID. And childrens are not, they are also prone for this kind of complications. So we cannot make them they are though the children's populations were affected very less, but as I've said, the it has percolated from the O. elderly person to the young. So children are more prone this time. But surprisingly and very, it was good to see that not much of the people were affected, and we have started vaccination much early, and that must have been the protective force.
So long COVID can affect children, but because of the immunization and various preventive measures being taken into consideration, children are very much, even if they are prone to it, luckily there has not been seen a lot of long COVID cases in children.
Yes,
So,
yes.
sir, here also what we would like to know is that, are antibiotics effective in treating the new coronavirus? Will antibiotics play a role?
See, madam, basically antibiotics are only for the bacteria. But what is happening in the COVID time, uh, the bacteria, this because of the overwhelming bacterial infection, there is a superimposed bacterial infection also, which is in fact responsible for most of the morbidity. Viral is taking the toll, and because of the disruption of the barrier, they are exposed to the bacterial infections. So we need to cover with the antibiotic, and there are certain antibiotics like doxycycline, which has got antiviral effect also, and they got immunomodulatory effect also, as well as anti-inflammatory. So that can be given as a supportive line, because there is always underlying fear once the defense mechanism is disturbed because of the virus invasion. So we are very prone for the, and so many lines are already inserted in the patients to for the fluids, for the, sometimes we need to have to intubate. Of course, those patients who are intubated, they have not done well. I've seen only one or two patients in where the hospital I'm admitting was has survived the post ventilation. So, but they do, they have definitely have a role. Even if the one patient survives, it makes a lot of difference to the family. So, whenever it was needed, we ventilated even invasively, but we tried to keep as non-invasive as possible for the fear of the secondary infection. So, antibiotic as a uh, if you say antibiotic, it has no role. But antibiotic which has got antiviral effects, just initially a lot of azithromycin was given to for the immunomodulatory purpose, but then it was subsequently withdrawn. But doxycycline continued because of its multiple actions: antiviral, anti-parasitamic action against the malaria, anti, even in the dengue, it was given for the same purpose. And so many mechanisms have been described along with the doxycycline. So it was continued, and people have derived benefits out of it. And at least, madam, we have no definite treatment line still for the COVID. So it's all empirical. So we have to rely on the small benefit patient is can should pass on to the patient.
So yes, sir. As mentioned, highlighting the fact that antibiotics, in principle, does not really play any role. But if there is a superimposed bacterial infection, it definitely plays a role. And also, antibiotics with multiple other properties, like doxycycline has, like sir mentioned about antiviral, immunomodulatory effects. It does play a superior role in limiting the disease progression. So
Yes.
here, sir, do you would you like to also highlight on the antiviral effects of doxycycline, since you mentioned the various properties of doxycycline? What are these antiviral effects of doxycycline which is helpful in COVID?
So there are multiple mechanisms. So it may be slightly complicated. It inhibits the MMP. First of all, this likely prevent the viral entry into the cells and effectively attenuate the viral induced ARDS. It also has an inhibition effect on the papain-like proteinase PL3PRO that mediates the generation of non-structural proteins which have a crucial role in viral replication. So, prevention of the viral replication is very important. You know, they replicates like anything, and lot of viremia, and that is hazardous to the body. And there were a lot of role of zinc that was described earlier. So many people are given high doses of the zinc, high doses of the vitamin C as the antioxidants, as the immunomodulator. So what doxycycline has done is it acts as an ionophore that increases the zinc intracellular concentration, which has a role in suppressing viral replication. It also has an anti-inflammatory property by suppressing the IL-6. You know, IL-6 has a great role at that time. Cytokine storms. 3 4 day once the viral replication shuts down. Once you kill the virus, then the second week, on fifth or day onwards or 7th day onwards, you get a severe cytokine storms, and that was difficult to save the life of the patient. There, the lot of tocilizumab was used, whether it was help the patient or not. Bevacizumab, tocilizumab, TF-citinib, and baricitinib, they've used, but they have suppressed the. Logically, they should be used at that time, but nothing act, and so many steps have been taken. A lot of patients have lost their life, severe ARDS, patient become unstable, lot of drop in the BP, multiple supports of the inotropes, and finally they succumb to the injury. I've seen the patients going up to 100% of the lung involvement, 25 by 25 score, and we kept on ventilating, but then there was no scope, and finally lungs become like rigid. So here the anti-inflammatory property of the doxycycline may have some effect. So we don't know, but then this was the drug in our hand. Nothing was final in the COVID time. So there was this was even they have got a effect on the antiretroviral has antiretroviral effect also. So we have seen in the we are using regularly in the dengue fever or dengue fever. So that was the thing, and zinc has a controversial role, but we still were giving because, and then the role came the zinc also causes increase in the mucormycosis. So many confusion was there, but ultimately, by God grace, everything settled down. Still, we are not very sure about what is going to happen in the fourth wave and what is going to be the uh, the future for India. But outside, there was not much of mortality reported. So some vague reports are coming from China, but not much of mortality reported. Because still, I'm in touch with one of my patient states. They are managing at home. High grade fever, COVID positive. They are managing at home. So no, and that time, year back or two, there was no place to admit the patient. They were dying on the lobbies. So I think we are still not able to contain the disease during that time. Let's hope the vaccination improves the morbidity and mortality.
Yes, so sir, multiple, as you know, for the viewers, it is multiple, sir, highlighted on the multiple mechanisms of doxycycline and its antiviral effects, and especially, in dengue and malaria and all now in COVID. So it has shown multiple benefits that way. Sir, you mentioned about, IL-6 also. So any other anti-inflammatory effects of doxycycline that you would want to highlight?
Yes, yes, it also suppresses the TNF, human necrosis factor also. That is one thing. And also, it has been seen that ACE in a receptors was responsible for making the entry of virus into the cells. So there is another receptor called CD147 that could play a role in mediating SARS-CoV entry into the cells. So this is also suppressed by the doxycycline. So these are the various effects what I could see from the drugs. It is a cheap drug, and it has got a multiple antiviral effects, and of course it's a good antibiotic also. So it was used extensively, and people derived a lot of benefit out of it, and we have seen as our own level. So that was one thing. The IL-6, various other interleukins, and as well as the TNF alpha.
Sir, you also mentioned about azithromycin being widely used, and then it wasn't. So, sir, what is the efficacy of doxycycline over commonly used antibiotics in COVID-19?
So, as I've said earlier, the antibiotic is hardly any role unless there is a secondary infection. But doxy was used because of its antiviral, anti-inflammatory property, and that has perhaps has an edge over the other antibiotics. Even if you use the higher drug, third generation, or the marrow, the imipanans, the panams, but then it's hardly any role against the virus. So this has an edge over other antibiotic because of this uh, antiviral, anti-inflammatory effect, which was very important at that point of time. Even if you are using steroids, it has a multiple side effects, and perhaps that was the reason why there is an increased surge of the diabetes as well as the several secondary infection as well as the fungal infection. So that was not in there with this antibiotic, and we all know the virus will take its own time, more than 2 weeks to settle down. So we need this drug as it is very important in replication in the early phase. So maybe you can use the doxycycline from 5 to 7 days from the onset of the symptoms. Of course, we need to individualize the therapy. We have to see whether the patient has other comorbid state, and subsequently we can revise our therapy. Nothing is final, but these drugs were commonly has often used and has given good results. So one antiviral, one doxycycline, and of course the symptomatic managements, and of course we need to give the anticoagulants. So this was
So,
a part of the
hmm, hmm, hmm. Yes. So here, one important, consideration to be given is that doxycycline, even though is an antibiotic, but more commonly was used in COVID for its other properties such as antiviral,
yeah.
immunomodulatory, anti-inflammatory effects. So, yes. So, sir, also, can you also mention about, what is the dosage and duration of doxycycline that it was given in COVID?
So we used to give a loading dose of 200 to start with, and subsequently 100 milligram twice a day. If patient is tolerating orally well, otherwise we are given IV doxycycline most of the time, and it should be continued at least for 5 to 7 days when the viral replication is very high. In the it is during the first week or first 5 days where the viral replication is going to take place, and after 5 7 days the body takes care of the virus. What is happening is the storm. The next week is just the end product of the viral virus, which are killed by the body defense mechanism. They are released and they cause a lot of release of the cytokine, cause a lot of inflammatory reaction in the body. So first 5 to 7 days, I think, is a good duration for the doxycycline to be given. 200 to start with and 100 milligram BID.
So, sir, since doxycycline has shown so much of positive results in COVID, can in your clinical practice, sir, have you also seen effect in other respiratory tract infections?
Yes, yes, yes. We have used in, of course, most of the URTI, and sometimes in the mycoplasma pneumonia, of course, we have used doxycyclines, or then this uh, even in the dengue fever, we have used a lot of doxycycline. So it's a good antibiotic, but it's a bacteriostatic. So we have to see, we have to monitor the count of the patients as and when, and see the procalcitonin levels, and subsequently we have to adjust. So there is no final word in the how the infection behaves. If you get the sputum culture or the blood culture, we can always go ahead with the proper antibiotic. But to start with, this is where it is a cheap, good drug. It's affordable drug, and it's a broad spectrum. So most of the upper respiratory tract infections are the viral. So, and if there is even an element of secondary infection that is taken care by both doxycycline. Both the bacterial virals are taken care of.
Okay, great, sir. Sir, we also, spoken about vaccination and about, children now getting vaccinated to prevent the, fourth wave. So, can you also highlight on what is the importance of getting vaccinated? How important is vaccination?
See, what I feel, why the incidence of the virus is less in the Indian pop subcontinent is, first, in initial wave they got exposed, and in secondly, of course, it was a very deadly wave. But most of the people are exposed. I'll give you example of my hospital. In first wave, 22 people got exposed, including me. And second wave, we worked very closely to the patient, very intimately. We were intubating, we are doing everything. None of the staff got infected. That time, the first dose of the vaccine was already given. In fact, it is like a second dose because we have already infected once and we have developed that antibody. So I feel we are protected because of the vaccination, and everybody should get vaccinated. And as per the protocol, children also should take, and they should also go for the booster dose. We are protected, well protected. Our otherwise, you see the uh, situation in other countries where they have not been vaccinated, like North Korea. You see, the people are still getting COVID. We are working now like a normal hospital, situation. We are not afraid of COVID now. Of course, there is a fear lurking behind our or over our mind. So, what I still feel, they should be wearing the mask now. They should be avoiding when there is no need to. go, and they should be with slight symptoms. They should be uh, taking care or doing the uh, going for the viral studies and get the things done, getting isolated and all things. But mask is, I think, should not be still. It should be worn for a longer time, maybe for a year or two. We should not be, you know, uh, we should not be at ease at the moment, because fourth wave here is lurking. I was in Delhi a few days ago. There were cases of nearly 300. So Bombay is reporting less, but I think because of the cross infection, or maybe a lot of people are vaccinated in our side. So, and why I'm finding most of the people are vaccinated. So things are better and better now. So one must get vaccinated at all cost.
So there is an importance to vaccination, and that vaccination will form a protective shield, over getting protection against the risk of contracting the virus again. So, sir, final message to the viewers. What is your final message?
See, first of all, we should get well educated about the COVID. It has not gone yet. It may stay as an endemic throughout our life, but anytime they can go in a pandemic form. So we should be avoiding unnecessary crowding of the area. We should wear the mask always. We should follow all the COVID related precautions like washing hands. We should not eat, at a unspecified place which is not hygienic. Then we should get vaccinated at all cost and get the booster done. And we should see that all our nearby neighbors and all, they should be vaccinated. They should be educated well, and children also should get vaccinated. Vaccination and mask, I think, is the in thing. We should prevent ourselves. We should not lose our lower our guard as far as the COVID is concerned. We have seen the worst period during the second time. Lot of family has been destroyed by the second wave. Nobody could do anything. We have tried all our best, so we should not want the another wave to struck. We should not lower our guard. So at least wear mask and get vaccinated. Vaccination is government is helping like anything. Only thing we have to remove the myth from our mind. A lot of people say comes and patient comes after vaccination. I'm getting cough. I'm getting this. I'm getting that. It is not because of the vaccination. You are alive because of the vaccination. So, of course, I am not saying it's 100%, but definitely it has changed the scenario of the country. Such a huge country with a thickly populated everywhere, so much crowd. We have to avoid the overcrowding. Now people are going to the hill station like anything. Overcrowding. That is, I think, we should be avoiding.
Great, great, sir. So, great session. Thank you so much, sir, for sharing, wonderful information with all the viewers. I'm really sure that they've got the required information about the possibility of the fourth wave. And very important for the viewers to understand that COVID is here to stay, and it is going to be an endemic going forward. So, very important to wear masks, sanitization, and social distancing, and wearing mask and getting the vaccination and immunized as and when it's given directives given by the government, to follow the directives given by the government. So thank you so much, sir, for your time, and for sharing such wonderful insights and your experience as well. I am really it was a learning session for me also, so thank you so much for sharing the information that you did. Thank you.
Thank you. Thank you, ma'am. Can we leave now?